All right, today we're going to focus on the chief movers for the glenohumeral joint. We're going to start with the chief extensors, and you guessed it, latissimus dorsi, very important guy. Origin's going to be the spinous processes of T7 to L5, that's a lot, and then also that iliac crest as well. It's also going to receive a little bit of help from the posterior deltoid, which is going to be right there, and then the tricep as well. Those are all going to help with extension, as well as the teres minor. It's going to help a little bit too. This is the latissimus doing extension, so muscles only contract if you look at the fibers in the direction they're running. That's the only way it can go. If we had to take a guess at which muscles initiate shoulder flexion, we should probably say anterior deltoid, for sure. And then also, I'm going to say the pec major, specifically the clavicular head. As I circle this clavicular head, I want you to pay close attention to the muscle fibers of this portion of the pec major. Muscles only contract, so these fibers have to go towards each other, and that's going to help initiate that shoulder flexion. The accessory muscles here for shoulder flexion is going to be the biceps. So the reason why I wanted to show you guys extension first instead of flexion is because I want you to start seeing the clinical significance of this. If you have a patient that struggles to get their arm overhead, which you will, what do you think is pulling that arm back and trying to prevent it from getting into flexion? Well, I'd say it's the extensors. So this is why it's important to understand not only what muscle is contracting, but what is being lengthened at the same time. How you address that problem from here is what provides variety in chiropractic. Some I agree with and some I don't, but essentially as long as you get to the right outcome at the end of the day, that's all that matters. So we spoke about the chief medial and lateral rotators in a previous video. If you need to see that again, go back and watch it. But as for the last two, it should be fairly simple as well. When I say supraspinatus, you should instantly think first 15 degrees of abduction, and then after that it's all deltoid. So those are going to be our primary abductors. And again, you can check the direction of these muscle fibers. It's the only direction this is going to go. And this is something I want you to consistently remember for the entire body. It's going to make remembering muscle functions and actions so much easier. So for adduction, let's go right back to the pecs. Maybe think about doing a motion like a chest fly at the gym and how you're squeezing your chest. That's that adduction that the pec major can do. And of course, that lat finds a way to sneak in and help with any sort of adduction. We can attribute that to where it inserts, and which is why also that subscapularis also assists a little bit in adduction with that teres major. Because if we look behind all of this material right here, dissect the pec away, we have this line that I'm about to draw, subscap, the lat, and the teres major. All of those are going to help in adduction. And that's mainly because they insert onto all the way at the front of the humerus, essentially, onto that intertubercular groove at or around that area, which helps with that adduction motion.